Welcome to Healing at the Speed of Light. Every week, we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Thanks for joining us again. Today is going to be the third and final part of our neuropathy workshop that we presented at one of our clinics. You can go back into the podcast to find parts 1 and 2. Now, some of the newer things that we've been able to do. Laser therapy and regenerative medicine, regenerative injections. This is where we really get into some of the stuff that we do in particular here. So again, I'm not trying to sell you on anything. I'm just trying to tell you kind of what we do, because what we do really does work very well for neuropathy. So first thing, laser. So laser therapy uses safe and non-invasive infrared light to stimulate some of the light sensors that are on the cells deep within the body. So you've got switches on your cells that actually respond to light. If you can get the right type of light deep enough into the body, it flips the switch to drive better circulation to those damaged tissues, as well as getting more oxygen from blood into those cells and then speeding up the metabolism of the damaged cells. So if you can speed up the metabolism, you can produce more energy in those cells, then they will either repair or they can even replicate and divide. You can produce new tissues. It just uses your body's own mechanisms, and what they've been looking at it, and I've just got a few sources pulled up here, and you can look up these studies, or we can send these studies to you if you want. But studies as far back as the 90s say that laser can be used for managing neuropathic pain, works by triggering biochemical changes within the cells, that's what we just talked about, speeding up that energy production, and that it has a positive effect in controlling, in particular for this study, diabetic neuropathic pain. This study, a different study, says that neuropathy, of course, which involves sensation, loss of sensation, pain, sometimes even amputation for some cases. But that laser therapy has been used to manage nerve injuries, as it holds the potential to induce a biostimulatory effect with no side effects. So again, we talk about medication, we're talking about side effects. We're talking about laser, we don't have to talk about side effects. These guys, this study actually measured the levels of vitamin D and magnesium, which are really big for nerve health. They measured the levels before and then after and saw a really good improvement in those levels just with laser. Now, get that. They weren't putting in vitamin D or magnesium. They saw improvements in those chemical levels in the blood after just doing laser. So it makes the environment better for healing. And then they saw a good improvement in quality of life after laser therapy treatments were done for these folks with diabetic neuropathy. Another study there, a separate study, says it can be concluded that laser, that's low-level laser therapy, is more safe and effective than gabapentin in the management of neuropathy. So that's not me. That's not me making that up. That's what the actual study concluded. Look, this is better. This is more safe, it's more effective than the most commonly prescribed medication for neuropathy. Okay, I'm not gonna hit you over the head with a whole bunch more studies. I had like 20 and I was like, I can't drown these guys in that. It doesn't, you get my point, you understand where I'm going there. I'm happy to send you any links that you want, those so you can look at the actual studies. Questions on laser before we go on?
How do you know when to stop? I mean, can you overdo it in one spot?
You can overdo it, but if you overdo it on a medication, what happens? You overdose, all kinds of terrible things. If you overdose on laser, you start to lose effect. So there's what's called a biphasic dose response. Basically, if you are in a lower dose up to kind of that moderate level, then you get a good benefit. Once you go over that line, then you get less and less and less benefit. So if you do too much laser, the worst thing that happens is nothing. So
what's the average number of treatments?
Ooh, that's hard. We've got I had one gal that we fixed in about 2 weeks. She had chemotherapy-induced neuropathy, hands and feet. She was from Virginia. She came out here for 2 weeks of treatment. She went home 95% done. We have some people that we work on for months, but it depends, right? You remember how many causes we had? And then our disease timeline, how far people go into this. If you've had diabetic neuropathy for 10 years, that's gonna be really hard to fix. If you've got spinal damage and you've developed nerve problems, neuropathy problems, that can be very, very hard to fix. It just depends on the case. And I hate to give out that kind of a vague answer, but it really does. We have some people we can fix, it's almost like rapid. And then we've got other people who have dealt with problems forever. Got a guy that we had in just yesterday, came in, his main problem was drop foot, that we talked about earlier, where he couldn't pick the foot up. So his left foot, no problem. Right foot, wouldn't move. 6 weeks, nothing changed. Beginning of last week, he goes, look, I can move my foot now. So some of these, it just depends on the timing. And I'll tell you a little bit about how we kind of set up our treatment plans, because what we don't want to do is end up with this long, involved, never-ending care plan. We want to get the problem fixed and get you on your way, right? But I'll tell you kind of how we do that here in a bit. Let me talk about stem cells, because have you guys heard of stem cells? Okay. There's usually ads and stuff that people have seen. Stem cells really are a wonderful thing. It's what we're going to really term it more regenerative medicine. But stem cells are the cells that have the potential to develop into different cell types in the body, and they serve as a repair system, so they can divide to create new cells. They can provide new nerve endings. They can provide new brain cells, blood cells, the whole bit. They're the really, we develop as a fetus from just a whole bunch of stem cells. You still have stem cells in your body too. They're the main drivers of repair. You know, most of us have a large amount in the fatty tissues. Some of us have more than others, I suppose. And then also in the bone marrow. So, but they're the ones that do most of the work. And here's a little bit of more of a graphic presentation. You can have one stem cell can create more of itself. It can create these new tissues, bone, muscle, fat, nerve. It can help to actually prevent ongoing cell death, and it can reduce inflammation too. So those cells that we're talking about, there's a whole bunch of different categories, and we're not talking about aborted babies or anything like that, okay? We're not talking about anything there. We're talking about the adult mesenchymal stem cells, the cells that you have in your body, all right? There's a couple different ways we can get those. One is from your own bone marrow. We can actually get in there and withdraw some bone marrow and sort those cells out, and then we can inject the cells where we want to have an effect. Or you can actually get these also from donated umbilical cords after a baby's been born. And those are pretty darn good cells because they're brand new, they're healthy, they're ready to go. They're not 35 years old or however old yours are. And as you get over 55, you have less and less healthy stem cells, so it becomes harder and harder to get good results. The umbilical cord cells are pretty good, but the studies say that, you know, stem cells, MSCs, mesenchymal stem cells, have an important role to repair tissue. They can actually lower blood glucose, and then they can help to impact the immune system to help with diabetic neuropathy. Again, trying not to drown you in all the research, but just pulling a few studies out here. Again, glucose lowering properties and beneficial effects for wound healing for diabetics and nephropathy, so kidney disease as well. Here's what we do, all right? If we have somebody that we're working on, what I will promise every time is that we will very, very carefully evaluate our individual patient's condition, and we're only going to recommend what's appropriate. If we don't have to go a regenerative medicine route, we won't. If we don't have to do laser, we won't. We won't do anything we don't have to do. But if we do need to do one of those, we absolutely have the best training, the best protocols, and lowest cost possible. I'm real confident saying that because I train clinics across the nation in how to use the laser and in how to do regenerative medicine. All right? It's multiple times a week that I'm on the phone with other clinics because they're working off our successes here to try and replicate it elsewhere, and they're doing very, very well. And lowest cost, we really try and shoot for something that's affordable. Yeah, we got to keep the lights on, all right, sure. But I grew up here. This is my community. My kids are growing up here. If we can take care of people, I want to be here for them. So most of what we do is actually reimbursed by insurance as well, by most of the insurances out there. And then this one, we don't operate a cattle mill. We don't run people through by the numbers. You have to, if you can get, I mean, you see what we're talking about here with the causes and the progression of these disorders. You have to nail this stuff down per the individual patient. Every single case is different. And if you don't handle it individually, if you just try and put everybody on a formula, you are likely to not have good results across the board. Our success rate is extremely high. I want to keep that as close to 100% as we possibly can. I really appreciate you coming. Hopefully you were able to learn something. Please help spread the knowledge.
So Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you are a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.